Hello, my name is Rory Connolly, and I'll be doing a cardiac peripheral vascular exam here with Corey Stedgy. Corey, have you ever been a patient of mine?
Nope.
Okay. I'll begin this exam by first looking at the jugular vein. I'm assessing the palpitation of the jugular vein and see if there's any external jugular vein pronouncement. I want to assess for pulsating of the vein itself in the neck area. I can measure this by using a straight edge and a ruler, measuring from sternal notch to where I see the pulsation less than 3, which is right about 3 centimeters. So if I look really closely here, there's a little pulsation right about here. It's hard to tell from the video. And that itself is right about 2 centimeters right off the bat. From there, I'm going to feel for the carotid pulse in the lower half of the neck. So right about right here. I'm not going to do in the upper part and do a carotid massage, which will lower the heart rate of the blood pressure. The upper part of the carotid sinus can do that, so I'm going to do it right down here. I'm also assessing this portion for brisk upstroke, thrills, kind of stuff like that. I don't want to do both sides at the same time because it could restrict blood flow to the brain. From there, I'm going to listen to those areas. I'm going to listen with both the bell and the diaphragm of the carotid. And this is especially important for patients with cerebral vascular disease. If I may have felt a thrill before, just to kind of double check on some of those things. From there, I'm going to show you some of the anatomical landmarks of the patient. So the clavicle right here, the suprasternal notch, which is right about here, and then the sternal angle, which is about 2 finger lengths down from this notch area. And that's roughly where the second intercostal spaces are of when we start doing this assessment. The right side is the aortic side, which is right about here. And the second side is the pulmonic side, which is right about here. From there, there's the third, fourth, and fifth areas that I'll inspect, palpate, and auscultate. This is called the third intercostal space is Erb's point, and then I'm going to be looking at the tricuspid and then the mitral right here. So what I'm going to assess when I'm doing this, I'm assessing pulsations over all these spots, and I'm also looking for color. I'm looking at lifts, heaves, thrills, any stuff like that. I'm also looking at temperature, uniformity, just to see if I feel any of that stuff. So I'm going to palpate that right now. I'm going to kind of inch my fingers down here. We're about here. And I don't feel anything at those spots currently. I'm also going to kind of do the same thing with the patient's sternum to see if I feel any lifts, heaves, or thrills on that part, which I do not. From there, I'll be doing some auscultation. I'll be listening to this part and in those exact same areas. Again, I'm looking for, on the aortic side, I'm looking for that S1, S2 lub-dub. Over here, I'm just trying to note to see if that S2 is louder. And then as I go down, kind of inch by inch, I'm just trying to hear that lub-dub. At the mitral area, I want to make sure that the S1 is louder. And this is kind of where I want to take a pulse for about a minute to hear that point of maximal impulse. And I'm also looking for split S2s, S3s, S4s, anything that doesn't sound like a lub-dub. Okay, from there I'm going to take the bell, listen to the same thing. I'm looking for any gallops or murmurs using the bell. All right, very good. Corey, I'll have you sit up from here. At this point, I'm going to listen to the left intercostal spaces. I'm looking to the mitral area. I have him leaning forward. I'm listening for aortic insufficiency murmurs that may be only apparent when the patient actually leans up like this. So from here, I will listen in here. Nope. And I'm not hearing anything with that. Also with this assessment, you would not do percussion just because it's not routinely done and it's kind of out of practice. So Corey, if I could have you lay back down, please. From looking at that portion, I'll go down to the abdomen section. First, I'll inspect for aortic pulsations. Sometimes you cannot see this because of stomach size. With Corey, we don't see anything of that nature. Next, I'll listen to bruits above the umbilicus with the diaphragm and the bell. Okay, and I'm not hearing anything that's not abnormal with the stomach area. From there, I'll listen down to the iliac, the renal, and finally the femoral artery. So I'll kind of listen right about here. I'll listen right here. And I'll just kind of place different areas just to kind of, allow for Corey's privacy. From there, I will look at the arms. I want to go down each arm. I want to assess for temperature, color, and when I get to the bottom, I want to check capillary refills to make sure it's less than 3 seconds. I want to look at kind of feel radial pulses and check the strengths. Then I want to check those brachial pulses to check those strengths also. All right, his arms look good. From there, I'll move down to his feet.
Sorry.
Nope. Okay, with the feet, it's a lot of the same stuff. You want to palpate the feet and inspect the feet for color, temperature. You want to look for hair on toes, see if the skin is shiny, and if so, if you note some of those things, the peripheral vasculature may be compromised. I'm also going to look for edema down here at the feet, and again, Corey doesn't have any edema, but with that, you double check pitting size, things of that nature. From there, I want to palpate some of the pulses. Okay, pulses feel good. Capillary refill feels really good. And from there, I want to assess Homan sign for DVT. And that's right about here. Corey, if I could have you bend your foot and then flex it right here. Any pain?
No.
While I'm up here, I can also look at popliteal pulses too. Pulses feel good. Same thing right here, buddy.
Mm-hmm.
Bend your feet. Any pain?
No.
Okay, lay forward. Any pain?
No.
All right, very good. And that is my cardiac assessment in a nutshell. Thank you.